Markey.
Thank you. Mr. Secretary, all I've been hearing from you today is your defense of and advocacy for brutal cuts to Medicaid, brutal cuts to NIH research to find the cure for Alzheimer's and cancer and other diseases, brutal cuts to community health centers, brutal cuts to the CDC, the early warning system for diseases, and all to find the funding for tax cuts for billionaires and millionaires. That's all I've been hearing. And it is absolutely unbelievable that the Secretary of Health and Human Services can sit before the Health Committee and make such an argument. So Secretary Kennedy, for months I've been hearing from people about the impact that you and Donald Trump have had on them. And for months I've been sharing their stories, and I've compiled them here. And Mr. Chairman, I'd like to include my Make America Sick agenda.
Without objection.
Included in the record. Thank you. This is a set of stories that are being told to me that I would like to relate to you. Jennifer, who's from Massachusetts, is a stage 4 cancer patient. There is no cure for her diagnosis. Her life depends on federal investment in research and for clinical trials to continue uninterrupted to find a cure for Jennifer with NIH funding. She's right to be worried. I heard from Henry in Rhode Island, who wants a continued funding for cancer research where he works. He's worried about getting fired because the lab's NIH grants under new leadership were cut. He wants to work on cancer research to find the cure for Jennifer. You've already terminated $1.8 billion in NIH funding, which for Jennifer should really stand for National Institutes of Hope. She's losing hope. You're defending a 40% cut, Mr. Secretary, in research for Alzheimer's, for cancer, for stroke, for diabetes, for mental health. They're being slowed, they're being slashed. And I understand streamlining, but this is not streamlining. It is a bludgeoning of our health future and a giveaway of our global scientific leadership, and it will be people like Jennifer who will pay the price. Lou from Massachusetts, he wrote to me about his son who died of an overdose. He said his son Zach was, quote, a loving and loved family member who had the illness of addiction. He wants research to cure this disease, funding for treatment without stigma, support for health workers serving people with addiction to prevent any other family member from suffering from the same fate. Can you honestly tell us that, or tell him actually, that you can cut $1 billion from the Substance Abuse and Mental Health Administration, including funding for programs to teach first responders how to use naloxone, to help to guarantee that other parents not lose their children? Can you honestly tell me that the cuts you have already made to addiction treatment across the country will make anyone healthier? How can you justify a $1 billion cut to substance abuse and mental health, Mr. Secretary?
Senator Markey, you weren't here when I was talking earlier, but one of the things that I've talked about is that the budget for my agency increased by 38% over the Biden administration, and Americans got sicker, and more Americans overdosed, and more Americans died from cancer, and we have now an epidemic of colorectal cancers in our children, and the chronic disease rate has now gone up to 60%. The autism rate has dropped to 1 in 31 children, and all that money that was supposed to cure those diseases or avert them, none of it worked. All we need is leadership and a new vision, and I'm bringing that to my agency. And I'm realigning my agency.
President Trump is negotiating with the Chinese about keeping fentanyl out of our country.
Well, that's a good thing, isn't it?
Well, in the meantime, we can't be cutting the programs for the people who are already suffering from opioid-related diseases. We can't cut the programs. Yes, it would be great if we could cut it. It'd be great if we could reduce it. While we're waiting for that to happen, why would we cut $1 billion from the programs that go to the families that have the substance abuse issues right now. Why would we cut it now before we get a solution to the problem? They need
First of
treatment
all,
now.
most of the programs that support addiction, including naltrexone, Narcan, Suboxone, methadone, housing, we operate under SAMHSA of 500 rehabs that give people access under Medicaid. We are keeping those intact. We have President Trump, because of his leadership, has dropped the fentanyl imports from this country because of his leadership at the border by 40%. So we're actually doing more with less, and we are going to continue to do that. And what I'm doing at my agency is I'm realigning all these perverse incentives that have driven up costs and driven down health. I'm realigning so that people can make money in this country and markets can make money.
Look at 80,000 people died last year. This is not about efficiency. This is about cruelty. Cutting these programs. These people are already addicted. These people already need help. You're slashing the programs that families need right now.
Senator Markey.
Thank you, Mr. Chairman.